My presentation will follow this format. I'll give you background information about the project. I'll also give you the study methodology. I'll also give results and discussion about the data collected and some challenges and suggestions that we want to share with the rest of you. Ghana, like many other developing countries, face sanitation challenges. If you look at the diagram or the photos, the two photos, somebody may ask, do you have these facilities in the city? The answer is yes. Some areas still have this deplorable state of toilet facilities. But this is where we want to end. This is the ideal situation where we have the sewage system or the wastewater from the homes getting into a treatment plant. But we are not there yet, so there's still room for improvement. So the project was designed to improve access to sanitation, to be precise, within the Greater Accra metropolitan area. The project was funded by African Development Bank through the Ministry of Finance and local government. The purpose of the study is to conduct first impact assessment of the project on health and education. And here I want to emphasize the schools. The project has 4 components. The first component has to do with sustainable household and school sanitation and hygiene. The other one has to do with improved waste collection and treatment infrastructure and services. And then the third one has to do with institutional strengthening and capacity improvement. And the last one has to do with the staffing, project management, audit, and financing. Just to give more information about the component 1, we started with the baseline, just to understand the gaps in the sanitation, the household that has toilet facilities, the schools with the toilet facilities, and even how to get the space, the land within the urban areas. We have to comb and also struggle to select the schools. The project had limited budget, and we're supposed to select 60 schools out of the lot we received from the assembly. The first component also has to do with a gender and disability friendly innovative school wash facility. Here we are talking about a facility where we have rooms for girls during their menstrual cycle or period to change, hand washing facility, and also we also have rooms for the boys to also ease themselves. The second component has more of infrastructural components. We're looking at condominium sewer systems, landfill and material recovery construction, and then piloting aquaculture and agricultural reuse of wastewater. There were also opportunity to provide training and capacity building for the district and assembly staff. The project supported 25 municipal and metropolitan assembly. This is a map of the Greater Accra metropolitan area. For the benefit of those who have not been to Ghana, Ghana share border with Burkina Faso in the north, Togo on the east, and then west part is Côte d'Ivoire, and then southern with the sea. Now the project, the survey was conducted within this municipality, and the survey was conducted in all the 60 schools, and there were sample household, 500 household, and then 4 focal group discussions were also conducted. The analysis was done quantitatively and then qualitatively, trying to compare the baseline data and the end-line data. And then I also look at the focus group discussion and the interview that we conducted. Let me shift a little bit. Yes, the result, we're trying to look at the gender segregation and realize that through the sanitation value chain, about 45% of the women got job. And we also realized that 48% of the beneficiary communities were females. We're also interested to know how many of the householders were female-headed. And it will interest you to know that about 42% of the household that benefited from the sanitation facility were females. This is the type of sanitation facilities that we provided. This is a resilient household latrine. It's an improved version of the conventional toilet facilities that we have. This is the biodigester at the back. So with a distance of 5 feet by 3 feet, you could have your facility beside your house. This is a preview of the facility. And areas where there are no space, the project provided extension of sewer networks within the city. Now, it will interest you to know that there's some improvement in terms of open defecation. As of the time we conducted the baseline, about 50% of the area was resorting to open defecation, but it has reduced drastically. Sorry, the change is around 11.8%. There's a drastic change. And also, there's also a practice of hand washing with soap. We realize that most of the communities, the household, are also practicing hand washing as a result of the sensitization and education that we conducted. These are some of the schools that benefited from the GASSLIP projects. You can see the smiles of people during the handing over. Girls and boys were also educated on the user, facility user education. You provided facility user education. The project also provided tricycles to improve waste collection within the municipality. So now we can say that the old way of collecting waste has been improved. The project provided about 250 skip containers and 50 skip trucks just to evacuate waste from the community to the landfill site. Another interesting data that we obtained from the school was that school absenteeism has also reduced due to the provision of school wash facilities. You could see the percentage reduction. I want to share some of the key challenges and suggestions to you so that we can also appreciate some of the field activities and how we're able to overcome them. Because we are dealing with urban cities, space was limited, or space was an issue. Some of the household beneficiaries were also not able to connect to the household sewer lines. So the bank has to come in to provide subsidy. My final recommendation is that wastewater has some nutrients. It's not just a wastewater, but we can make use of wastewater, especially if it's treated to acceptable level. The project is piloting aquaculture. So the final treatment of Accra Legon waste treatment plant, the final effluent, is being used for aquaculture. These are some of the impacts that we have made through the implementation of GASSLIP. Thank you. Merci.
Thank you, Danielle, for interesting presentation. Any questions? All right.
This question is not for the candy. I have a legitimate question. Thank you so much for that presentation. On one of the charts where you were showing the reduction in open defecation, you also showed a reduction in use of shared facilities. And I may have missed it, but was that one of the project goals as well, to move towards household toilets, or what was that about? That
Yes, so the project has different components. We have the household toilet facilities, and then provision of institutional toilets for the schools. So the schools, we selected 60 schools, and they were all provided with hand washing facility, toilet facilities, and they were also provided some water to aid in the hand washing in the schools. The household, they have the subsidy. The household toilets were subsidized. The householder paid 30% of the cost, while the government supported 70%. So, yeah.
Thank you.
Additional questions? Yes, in the back. And if you now, we need to use the microphone for the remote audience. And if you can please introduce yourself and then ask your question.
Hi, thanks. My name is Emery. I'm a master's student at Indiana University. And I was just wondering who funded this work and what the mechanism was there. It sounds like a big project.
Yes. The entire project was funded by African Development Bank. It's a loan that the Ministry of Finance secured from the bank around 2019. But we have received extension because of the last component, the landfill material recovery. It takes time, and land is an issue. So the actual funding is from the African Development Bank, about 90% from the bank, and then 10% from the government of Ghana as in kind.
Time for one more question before we move on. Thank you very much.
Well,
Thank you.
And the next presenter is presenting on home grounds, Professor Musa Manga, and presentation I am personally really looking forward to. All right, same timing, 10 to 12% to present, and then some questions. Sure. The floor is yours.
Thank you so much. I'm just going to talk about understanding pathogen dynamics in on-site sanitation systems. I am going to keep the presentation very simple. We've tried to compress the 1 year's work into 10 minutes. So I'm going to focus on trying to address some of the recently published works which actually indicate contradicting results, and that's why we actually went ahead to focus on only this aspect of this work. So I've structured this presentation into 5, where I give you a background to the study, I talk about the methods used, and talk about the results, and then talk about some of the future works as things are still going forward. Okay. So we all understand that sanitation infrastructure, those are the pits and others, are very key in trying to intercept the release of pathogens to the environment. And whenever we do have this, because if you don't have proper sanitation, what you're going to have is you're going to have release of fecal waste containing all these pathogens, and exposure to these pathogens in the environment usually leads to a significant public health and environmental risks. So we really worry about that. So because of that, we need to think about sanitation infrastructure and look at it carefully. So mostly we're talking about on-site sanitation systems, are these systems which receive wastes within the compound and treat it in the sample. When you try to look at these systems, one of these systems, they have to be properly designed so that they can contain these kind of pathogens and even inactivate them, so as to maximize public health benefits. However, we don't fully understand this, even the dynamics of these pathogens in these systems. Even some of the work published is actually contradicting and reporting contradicting results. So for that reason, we need to make sure that planners, sanitation engineers, they understand the importance of these systems in activating pathogens, even though some of these systems are not designed to inactivate pathogens, but we need to start thinking about them in that kind of way. Because if they are really well designed and operated very well, they can actually do a good job in reducing some of these pathogens. Because of that, we set up to do these objectives. One, to understand the typologies in the community we're working in. Two, to understand the variation of pathogen indicator, which we used as an indicator pathogen in the different phases of the on-site sanitation systems. And three, to understand some design features, operation practices that could really influence the reduction of these pathogens. So to do this, what we did the study in Uganda, and we worked in Mulago, Bukoto, and Kamocha. We also worked in Zambia, in a place called Chunga, Kanyama, and Kaunda Square. That's where we did. And what we did when we got there, the first thing we did was to conduct transect walks to understand the different systems people have in all these different communities, and also know how these systems are, where are these kind of systems that they do have. And when we finished with that, the next thing we did was to conduct key informants interviews. And these we are talking with people who construct the systems, the people who are emptying them, to really understand better the systems they do have. The next thing we did was to really conduct sanitation user survey. We went on the system, we are going to sample. We talked to people using them to tell us the age, when did they last empty them, how many people are using these kind of systems. So we did that. And then from that point, we actually had to collect, do observation surveys to know what are the systems, empty content out of them to understand the systems, and also have a feel of, picking samples from there. When you got those samples, so one of the things we did was we collected samples at different points. Okay, hopefully it works. So we collected samples. What's wrong with, okay. We collected samples. For example, this was the fully lined tank with overflow pipe. We collected samples from the effluent, from the scum, from the influent, the liquid and sludge. We did the same thing for those pits which are not lined. We collected from the bottom, the middle, the top. And those which are actually lined, we also did the top, middle, bottom. And we did the same thing for those which do not have effluent pipes. So we collected influents, scum, liquid, and top. So we collected these samples to understand the kind of pathogens in these kind of fractions. And then what we did, so all of these kind of systems we encountered in these areas. One is a fully lined tank with no overflow, and I'm going to keep referring to this later. Another one was a fully lined tank without overflow pipes. That's the one whereby it's like a tank, everything goes in there stored. And then the other one is the kind of lined pits, but allowing exfiltration of the liquid. And then the other is the unlined, nothing like a wall. You just dig a pit and people have the waste in there. So let's dive into the results. What did we find? So the first results are the ones from unlined pits, where we sampled top, middle, bottom. So here I'll be showing you the distribution of, so here is the log, E. coli, and here we're trying to show you the different kind of, from the top, middle is the top, is the middle, and is the bottom. Here what you see is now the real results. The other one, the distribution of the results. What we saw in this pit, which is now contradicting what people have published recently, showing no variation in the pathogens, and therefore you shouldn't even bother sampling, thing about that. So we say no. The results are showing otherwise. They're showing, if you look at the real pathogen indicator and trying to know how efficient it is, you probably see more pathogens in the top content and less in the bottom, and some, and they are really different. The same thing we thought, maybe we need to look at another system, maybe it performs differently. So we also went and looked at the one that's referred to as a lined pit, which allows exfiltration. We're actually seeing a similar thing happening, that even with these, you probably see, as much as the distribution is not that much, but we still see that the top sample, the samples from the top, is actually having more E. coli log per total solids compared to the bottom sample. And clearly this still also show exactly what is happening. The other thing we also did was like, maybe this is different from other types of tanks. So we went to the fully lined tanks without overflows and said, let's understand if really we see the same difference. Surprisingly, it's clear that...
Title says with or without overflow.
Sorry, with overflow, sorry. So what we did here is we went and sampled the liquid, the top, And the same thing is different. We still see that the kind of environmental contamination or kind of pathogens in the top is still more what's in the bottom. And this is kind of the hypothesis we've been having for a long time, and we really had to really validate it with the real-time system. And for that reason, we said, maybe this is different from people using like tanks, as holding tanks. And then we said, okay, let's try them out as well. So we also picked samples from those without overflows to really understand if this is different. And still the same is true. So we find, depending on whatever way you're sampling, the bottom will have less and the top will have more. So this was a starting, and we're trying to think about this and try to look into all this. So then what we spent some time saying, let's try to step back and look at the entire systems, and let's compare now the composite samples in all the systems to see if you compare them. What you see here, I'm trying to show you the influence sample. This is the influence going on. So we're saying that within these systems, still we have reduction happening, and this varies. So what this study tells us that the performance of these systems varies significantly within the systems. And then that pushed us to really find out why. What we investigated was, can we look at the total organic, to look at the real sample? And here we looked at the organic, to look at the total volatile solids. And we're seeing that there is kind of a correlation between that. And we see that whenever you have, on this x-axis, we're showing the total volatile solids, and here we have the E. coli. And we're seeing that as you have more organics, you have more pathogens. And this tells you that maybe the sludge is still fresh, so there's still more organics and more pathogens that have not been broken down. To summarize, we also look at the design of the systems, and here we looked at the user, so we looked at, the operation practices, and we look at the number of people sharing the facility. Every time you have more people sharing the facility, there's more pathogens we're seeing in there, in that content. And the other one we looked at was more on the emptying frequency, to look at, does this come at storage period? What we're seeing, apart from this, which we want to go and investigate further, we're seeing that the more you store it, we see more reduction in the pathogen content in that slide. So what do we take from here? We take this, that previous studies have indicated that the content in all the systems are the same. And therefore, the sampling campaign, you can just pick a sample from the top, and that's it. We disagree. What we see is we need to sample all the fractions, that the liquid fraction has more, so the top sample has more because there's less breakdown. And therefore, you should focus on storing the content for a longer time because you get less pathogens. And therefore, we should also focus on the design and operation of the systems because that influences the performance. Next steps, we have the enteric data, which is, I wanted to make it simple, so we're really now going into getting the enteric data, and also assessing the typologies contributing to the pathogen flow, looking at the entire hazard model that we're actually refining, and also trying to finalize that. But nothing would have been possible without acknowledgement to the team that have worked with us, and all the program officers from the Gates Foundation, including John Willem, was our first program officer, and had David, and then we have Najib currently, and the entire team at UNC and all collaborators in those. So thank you so much.
Thank you so much. Is this working? Yes, thank you so much. How come you pointed me out sitting here and not Pete as your co-conspirator on this project, who's also here? All right, who can I invite to share a question with Musa? All in the back. And if you can please introduce yourself and ask your question.
Hi, I'm Claire Furlong from IHE Delft in the Netherlands. I just wanted to, can you tell me if you found, I was a bit confused, is there a difference between the top, middle and bottom in E. coli levels?
Yes.
And, okay, because it didn't seem like a huge difference.
Yes.
I was wondering how you sampled and whether, like, these look really wet. Like, they're quite wet and it looks like you have perhaps quite mixed systems. Is that right?
Yes, I'll explain. For the dry pits, they were not mixed, but the real kind of like septic tanks, those were mixed. That's why we sampled only the liquid and the solids. For the pit latrines, they bit semi-solid, like really like the real sludge. So thick sludge, like almost stool on top, and they kind of broken down. But you remember it allows exfiltration, so that means also a bit dry, and then the one down.
Did you get stratification in your pits or not?
So we got that in the pits. So we managed to. So when we're sampling the pits, we are using a deep sampler. So it's like.
Is it the Cora?
Yes.
Yeah,
so
okay.
we do that.
Okay. Okay, I do have. And one of the things is there's lots of literature about, because you're looking at E. coli, about regrowth.
Yes.
And you're talking about you didn't get the reduction you was expecting. Have you considered regrowth of E. coli in your systems?
So one of the things we did now, we use E. coli as a pathogen indicator, but we really are analyzing the enteric pathogen in the entire system. So we're really looking at the entire real system. So this was just what we saw because we're using it for performance assessment.
But are you going to be using PCR?
Yes, we're using the PCR, but we know that we're going to use the E. coli itself to help us,
So you won't know what viable pathogens.
So yes, that's why we start with E. coli, and we have ascaris as well as the viable ones to help us with this.
Maybe you two should talk.
Yeah.
Presentation. We actually have to move on if we want to stay on track. So, Musa, thank you very much. Right, and as what I think is the last presentation today, because the fourth presenter didn't show up. Oh, you are here, okay, just a moment. Maya from Soil in Haiti, go ahead.
Alright, good afternoon everyone. Thank you for sticking through to the end here. Again, my name is Maya Lubeck-Schricker. I am the research director at Soil. Soil is a container-based sanitation organization operating in northern Haiti. This presentation today will be on some results from a recent study we did with some partners at Accra on willingness to pay for our services. Pretty standard agenda. I'll start with a very, very brief background of what we do at Soil and then some research contexts and methods and getting into the results, big picture, next steps, all that good stuff. So, Soil is a container-based sanitation organization operating in Haiti's second largest city called Cap-Haitian, and our services are called Ecolacai, so I might use both terms interchangeably. Again, I'm just going to do a very high-level overview. I'm not going to get into the details, but if you have more questions, I'll be happy to answer those at the end. Currently, we serve, we just reached 4,000 households over the weekend, so that's about 20,000 people in the city. And they're responsible for paying a small fee of 350 Haitian goods, which is about $2.65 per month. And so for that monthly fee, households receive this toilet that you see here, which doesn't require any additional infrastructure. It contains waste in sealable, removable containers, and so each week when the containers are full, households will put a lid on them and set them outside of their home, and our staff will come around and collect all the containers, give them clean ones for the next week, and then we transport the waste to our treatment site outside the city, where it gets transformed into nutrient-rich compost. Our service represents the only safely managed sanitation service that addresses the entire sanitation service chain in urban Haiti, and we address issues including human dignity and quality of life, climate change, environmental degradation, economic disempowerment, etc. So just a little bit more context here. We are currently undergoing pretty notable expansion of our service due to, we're in the second phase of a results-based financing initiative. And so with this expansion, we're really hoping to be able to focus more on some of the most vulnerable households in the neighborhoods. And when I say that, I mean we're really targeting people who are practicing open defecation, as well as those who are struggling, who may struggle to afford our monthly service fees. So we have done some previous internal research that has shown that households in our service who are in lower wealth quintiles struggle to pay our monthly service fees on time. And we also conducted a couple years ago a baseline quasi-census survey in 8 target neighborhoods where we surveyed over 4,000 households. And in that survey, we found that 19% of the population was practicing open defecation, and that was exclusively among households without access to a private toilet. And lack of access to a private toilet was primarily attributable to costs. So what all of that suggests to us together is that targeted subsidies could help us expand our service. So before we can implement a targeted subsidy program, you need to answer a couple key questions, one of which is what would be an appropriate subsidy amount. So we, again, partnered with a team from Accra to conduct this study to assess household willingness to pay for our container-based sanitation service, and also to look at factors that may influence that willingness to pay. And our ultimate objective was to identify an appropriate service fee and therefore a subsidy amount that would be needed to achieve 80% sanitation coverage in our target neighborhoods. So for the survey, we surveyed 4 specific neighborhoods around the city, and we conducted the survey in March and April of this year. We collected data from 603 households in total, and all of whom were not already customers of our service. And this survey collected information on household demographics, sanitation characteristics, wealth using an adapted version of the equity tool, and willingness to pay questions, and this is stated willingness to pay. After doing some initial preliminary analysis, we also conducted focus groups with community leaders and households to kind of better dig into some of the quantitative trends that we were seeing and understand what's going on there. The stated willingness to pay, we used the double-bounded dichotomous choice method. If you all listened to Valerie's presentation yesterday, this will look very familiar. So households were randomly assigned an initial price point, and that was anywhere between 100 and 700 Haitian goods. Again, our current fee is 350, so halfway through that range. So households were randomly assigned a quantity and asked if they would be willing to pay that. And then if they said yes, they were asked about the next highest quantity, but if they said no, they were asked about the next lowest quantity. And that's just to kind of anchor understanding anchor a price point. And then they were asked a third open-ended question about what the maximum amount they would be willing to pay for our service was. And that responses to that third question are what was used to construct the willingness to pay curves. Getting into who our sample was. We found that 39% of the surveyed households were in the bottom 2 wealth quintiles, that is to say the poorest 2 wealth quintiles. We also looked at vulnerability using 6 locally defined criteria. If you have more questions about that, I have a poster after this and I'd be happy to talk more. But you can see that vulnerability really varied depending on the criteria, anywhere from 8% up to 89%. We define open defecation to align with the Haitian Sanitation Authority's definitions, and so with that we found that 11.6% of households reported practicing open defecation. And interestingly, 78% did report already having access to a private toilet. That was a little bit surprising to us because that previous quasi-census baseline survey I mentioned found slightly lower proportion, that was at about 60%, so this was a little surprisingly higher. We also asked about satisfaction with current sanitation, with current sanitation that the household uses, and we found that 41% were dissatisfied with that. And again, that's a little bit surprising, just given that 78% had access to a private toilet. So that suggests that there's a notable overlap between you may already have private sanitation, but you still may not be satisfied with it. And then we asked if they'd be willing to change their toilet, and we found 34% might be interested in changing, and that's kind of an opportunity for us as a container-based sanitation provider. So, into the willingness to pay results. This is our overall demand curve. So this is the entire survey population, all 603 households. We found that 85% were willing to pay 150 Haitian good, 75% were willing to pay 250, and then 60% were willing to pay our current fee of 350. We also wanted to explore this willingness to pay by several factors. So here we've broken it up by wealth quintile, again according to the equity tool. And what we're seeing here is that the willingness to pay for those in the lowest quintile, so again the poorest, was notably lower, while those in the highest quintile was notably higher. Not that surprising. What was maybe a little bit interesting to us is that the middle three quintiles really didn't have notable differences in willingness to pay. We also wanted to look at willingness to pay by neighborhood. This is because we did see some differences in neighborhood characteristics in terms of demographics and wealth, but interestingly, despite those differences, we're again kind of seeing pretty similar willingness to pay across all of those neighborhoods. And this is the final curve that I'll show you, which is looking at it by current sanitation access. So we have households who already have a private toilet, those who have a shared toilet, and those who don't have any. And again, this was kind of a surprise for us because there were not large differences in willingness to pay by current sanitation access. And so we dug into this a little bit more with some of the focus group discussions, and we learned that there are many reasons why a household that already has access to private sanitation might still be interested in our Eco-Lakai service. And that's because our service can be cheaper than, say, emptying a full pit. And pit latrines can also smell and have cockroaches and be kind of dirty. And so some households said that maybe they wanted a different toilet for when guests came over. Or in general, if households just have a lot of people living within the residence, they might want multiple toilets. We did conduct a linear regression here. And I know there's kind of a lot going on here, but generally we found that households were more likely to pay more if they were richer, satisfied with their current sanitation, or their current toilet lacked privacy. I will note that this whole model here only explained 4% of the variance in willingness to pay, but when we did add initial price point, that boosted the explanation of the variance to 28%. And so what that suggests to us is that willingness to pay may be more influenced than that anchoring price point than necessarily their demographic socioeconomic factors. In terms of big picture, we believe that targeted subsidies are needed to ensure equitable access to sanitation services in our neighborhoods. Because of that finding that 78% of households already had private sanitation, we may not need a discount to achieve 80% private sanitation in these neighborhoods. But if we instead pivot to talking about coverage of our service, which again is the only safely managed sanitation service, then we may need subsidies down to a fee of 150 good. And that's the amount that's associated with 85% willingness to pay, and I will note that stated willingness to pay is often higher than revealed. We don't yet know what that revealed willingness to pay is. We're going to find out soon. And so it's maybe a good idea to be a little bit conservative with the amounts that we choose based on that. And speaking of next steps, we conducted this survey on willingness to pay together, exploring different subsidy targeting mechanisms, and so our intention is to combine these results with those targeting results in order to prepare for a targeted subsidy pilot that we hopefully plan to launch early next year. Our plan is to start with households that are already in our service and struggling to pay our monthly fees, and then maybe down the line we'll be able to expand to new households. So with that, thank you for listening, and happy to answer any questions.
Thank you so much, that was great. Any questions in the audience? It's okay, you can ask questions.
Hi, it's Claire Furlong again from IHE Delft. I was wondering if you could comment on the willingness to pay and the ability to pay for in the poorest people in Haiti. Like, is it doable for them or not?
Yeah, so again, this was the stated willingness to pay survey, which generally speaking, Valerie talked about this yesterday, is known to be higher than the actual revealed ability to pay. I will say some of our staff were surprised to see that 60% said they were willing to pay our current service fee, so that reaction is a little bit of an indicator of that offset. But again, we don't entirely know yet, and so it's only when we start to implement this targeted subsidy program that we're going to be able to see more clearly what the actual uptake of that subsidy is, and if there's maybe still some people that are getting left out.
What percentage of their income and what the income would be?
That is a good question, and I don't know the answer right now.
Repeat the questions.
Oh,
for
sorry.
the audience.
The question is what % of household income is that fee? And I don't actually know off the top of my head. Sasha, do you know?
Oh, don't do that.
They will confer after the
Yes,
presentation.
happy to follow.
We have room for one final question before we move on to our last presentation. And absolutely. You can introduce yourself and then ask your question.
Hi, my name's Anvesh from Sanitation and Health Rights in India. I was just curious about the pricing model. You mentioned that in households where they have guests or where it's a large household, they might require more than one. Does the price, so for example, if I have a very large household and I say I need more than one toilet seat, but then the collection happens only once, even if I have 4 seats, it happens at that one time, right? So how does the pricing structure change, if at all? And I was also curious, in your x-axis relating to the demand curve, your endpoint was at 800, which is like a little higher than what you actually proposed. And I was just curious how you reached at that 800 point. Was it just to see like the demand curve, or was there something else that you guys were thinking about?
Sure. So I'll take the second one first, which is, again, the demand curves were structured with the third open-ended question, and so households could say any quantity, even if it was outside of the range that we asked about. So that's why we're seeing that higher quantity. To your first question, we charge the same fee to all households, regardless of the number of people they have in the home right now. And so for some households, we give them multiple containers each week. And so we can kind of, there's a little bit of push and pull there of seeing how many containers they need, and then they can set that amount out, and we'll always exchange the amount, the quantity of containers that they set out for us.
Do you have a container to person ratio?
If you can speak that into the microphone.
Yeah, he asked if there's a container to person ratio. I think right now, it's not precise because it's really hard for us to track the containers. I think our general assumption is 2 per household. 2 per household per week is our general assumption. Yeah.
Thank you so much. And it looks like interesting further discussion. And we have one final presenter. Bear with us for a minute when we upload this presentation.
You all need some help?
Hey, how did you know that?
I think
Magic.
Magic, that's amazing.
I copied it to the. It's like you should do it, right?
That should do it.
Please, 10 minutes for your presentation and about 5 minutes for us. And I will hold up the sign when you're out of time.
Okay, thank you so much. Soib Semyaga from Makerere University, Uganda. And I'm just going to briefly talk about the environmental contamination risk or pathogens released by locally constructed septic tanks in quotes, and that's why it's in quotes, because in this presentation you're going to see actually that the areas we dealt with in Kampala, they're not septic tanks. This is an expound on the presentation presented by Dr. Musa Manga, and this is just going to look just a little bit into only two parishes or neighborhoods, and mainly focusing on septic tanks in courts, or which are also called fully lined tanks. Now, there is always an increasing trend in our countries having people constructing these tanks, but they are locally constructed without proper designs, and even the operation and maintenance is not proper. And this always has a linkage to the pathogens that will flow into the environment. And this is also exacerbated by the environmental factors like the soil types were there, the groundwater depth, the slope, and other factors. And actually in this presentation we are going to be looking at these factors. It's identifying the different septic tank typologies in the two neighborhoods that we dealt with, looking at pathogen concentration in effluents, and also assessing the environmental vulnerability. The two parishes or neighborhoods that we worked in Kampala, that is, I think the name is Mlago 3 and Bokoto 1, but I will not use the names because many of you may not remember them from here. I'll just talk about the two parishes or neighborhoods. And here, what Musa talked about, I will not say so much about the methodology that we went through and having transit walks through the parishes, having also the interviews, but I'll mainly talk about also what in particular was on these tanks. We identified 13 criteria for what the septic tank should be, what a true septic tank should be. That's a criteria which you're looking at there. I'll not go reading one by one, but in total there were 13 from literature. And here we assessed a total number of 73 tanks in brief, assessing these criteria and also looking at the effluent sampling and also doing the laboratory analysis. But on top of that also, we're also able to look at also the environmental characteristics like the surface water proximity, the slope, groundwater level, soil, and others, and wanted to look at how also all these influence the pathogen flow within the environment. In brief, I'd like to say when it comes to septic tanks, we had 4 different categories, septic tanks in quotes. There were 4 in categories, and the first category, which is 2-1, is about 70%, where you have just a tank without any buffer connected to a soak pit. And the second one was just like the 23%, just a tank, and then it has no overflow. Then the type T2 was about close to 6%, where the flow was to the nearby drains. Okay, and lastly, it was this, which was also the T4, the line tank, but you have also the open bottom. So that was also another typology. But in brief, we had, if you look at all those and looking at the compliance for the 13 criteria, you realize that about what we are seeing down here is the number. Okay, sorry. What you are seeing down here is is the number of criteria. I said we had 13 identified criteria, and you'll see that about almost all tanks could satisfy at least 4 of the 13 criteria, but those that could satisfy all the 13 almost were not there. And most of the tanks they did not go beyond 8 of the listed criteria. But what is interesting is what was list compliant was having chambers. Very few tanks could have 2 chambers linked with this ratio, And the most compliant one was mainly on having minimum width, access for emptying, and then the water tightness. And this automatically qualifies it to be a fully lined tank, actually. So mainly, this is what we had, and I think we could be right to call them fully lined tanks rather than septic tanks. Another thing here is about the operation and maintenance of these tanks, which were assessed in these two neighborhoods. You could see, not go one by one, but the level of sharing with the households, the number of users, slight volume, whether they have been emptied. But at the interface, you can see the cistern flush toilet was the most common interface on those tanks. And then also maybe what I will talk about is mainly we're having households sharing a tank, a fully lined tank. Then also another thing here, I'll briefly mention that if you look at the level of the operation and maintenance practices, also design practices, vis-a-vis the reduction in pathogen concentration, you are going to see that where we had shared, where the lined tanks were shared, where the influent, that's black water and grey water, versus where it was only grey water, you find that we had more of the pathogen concentration when the user interface was poor flush, versus like the cistern, we had more of the pathogen. And also the design when it comes to poor inlet-outlet configuration, we had more, and then when it comes to location also of the tank, we had more of pathogen concentration by that much. But we had a number of design features also where there were no significant changes in pathogen concentration. But again, what is interesting here was also the number of people, the volume of the tank per people used, and also the years the tank is in operation. Okay, I'll also briefly talk about the vulnerability, and looking at the vulnerability, we had different factors like the tank density, having many tanks in the same area, and quite in these neighborhoods, the tank density was quite high, above that many that I've recommended. It's quite high, and the vulnerability is also high. But mainly in this area, like this neighborhood where the tanks, we had more that were discharging into the drains and having more where the tanks are connected to soak pits. Then you also have the number of users. You realize also where we have more users, mainly in some of the places we are seeing places with apartments or rentals or commercial hubs where many people are. Again, the contamination vulnerability is high. Then when it comes also to effluent disposal, the same thing I talked about before. The topographic wetness index, also you find that in valley areas where they are closer to groundwater, also the vulnerability is high. Vulnerability is also high when it comes to soil types, like the soil types they had in this area. They are ranging from low to medium permeability, where it's not like easy to infiltrate. Again, the vulnerability is high. Again, when it comes to the slopes, the vulnerability is high when they exceed 20%. Then proximity to surface water in these neighborhoods, streams running by, so you find that the vulnerability is higher, closer to the water. Then also looking at the ranking, we came up actually, what was ranking more is mainly not the design alone, but the site conditions came out also to be key factors here in ranking more to vulnerability. So of course all this speaks much more to the authorities looking at when they're looking at enforcement of designs, enforcement of the construction, enforcement of standards, that they need also to look at not only design but also where such kind of facilities are going to be. Okay, so I think I'll not say so much on this because of time, but in brief, you see that we had widespread of non-compliant tanks, and also it is important to know that there is a need to strengthen regulatory oversight, integrate spatial risk data into city plans, and promoting context-specific technologies. This is important information for us because it's also part of the ongoing study of the campus tool, and thanks to the team behind the campus tool, the UNC Manga Lab, and all other field partners. Thank you so much.
Thank you. Almost perfectly on time. I think we may have time to squeeze in one question. Happy hour doesn't start until 4:30 anyway. So, anybody who would like the floor? I knew I could count on you. Yes.
So many chocolates for you.
Any other chocolates?
It's just that it's also super interesting. I can't hold it back. I was wondering, you were talking about performance factors or operation maintenance factors related to E. coli levels. Is some of that just related to dilution? So if you're flushing in grey water as well as black water, you're not removing more E. coli, you're just diluting it. So I was just wondering if some of those factors, it's not removal, it's just because E. coli is it's a concentration, so it's CFU per 100 millilitres. So the more liquid that's going into the system, it's going to be diluted.
And what's the question then?
It was just, have you considered that there's not removal, there's just dilution?
We have not gone so much into.
Okay. And I'd like to talk.
But,
oh, sorry.
Yeah, we've not gone so much into that. But true, when there's more water, there's more dilution. But also, when it comes to the grey water, in most of our contexts,
Okay.
a lot of grey water also has pathogens in it.
But at a much lower level than shit.
Yeah.
And I'd like to.
I wouldn't bet on it.
No,
No?
Yeah.
Not at a lower level than shit.
but sometimes it actually has more than it is in shit.
You guys need to talk.
Yeah, there's quite a lot of reuse of our grey water, and you find the concentrations many times are high.
Okay.
Yeah.
And I think you need to look at the units for relationships with the number of people, because you're looking at concentrations, and that won't vary so much between the number of people using.
I'm not hearing clear.
Okay, I'll talk
I
to you
think-
later.
Okay, we shall discuss it.
As I said, you guys need to talk, and anybody who wants to stay can stay, but we have come to the end of the session. And I want to honor the clock and other commitments people may have, but thank you so much for joining us here, and please a final round of applause for our presenters. That's it. Enjoy the afternoon.
Can we get a photo of the 4 presenters? Are you all still here? Yeah. I mean, everyone else can go, obviously, but I would love to take a photo.
Hey,
Yeah, I want to take a photo of you 4 and Young Moon.
And all the
The
questions.
stars, and right, and maybe Claire, she was a real All right. You're okay? Yes, there's okay. Great. Oh, no, I won't. No, I won't. No, I only have 1 chocolate. All right, I'm willing behind. Okay.
Boom.
All right.
There we go.
Good. Thank you all. We will find a way to share. Hey, yes.
1, 2, 3.
Oh, sorry.
Oh, now everyone's, it's the paparazzi around.
Okay.
Oh, thank you all, thank you all. Thanks for your presentation, that was great. Thank you. You like to know each other. I'm Sasha from Soil.
I'm gonna stick
Heard much about you.
Oh, yeah. I know I've been doing a lot of things on composting.
Oh, you know what, you get better compost stickers. And sorry, what was it? Dun, dun, dun. The compost stickers. Amazing. Well, oh, you reach out to us anytime. So we love that. And you'll find us in this time.
Okay.
All right.
How'd it go?
We're gonna have some chocolates left, but